All right. Hello, and welcome everybody to the Babies in Common videocast and podcast. I'm Jeanette Mesite-Frem, the owner of Babies in Common. I'm an internationally board certified lactation consultant, childbirth educator, mostly retired doula, and mother of 2 teenagers.
And I am Melissa Ann Dubois. I'm a registered nurse, childbirth educator, and lactation counselor. I've worked in all sorts of hospital and office-based OB/GYN settings. I'm currently providing postpartum home visits for clients of Embrace Midwifery, a home birth practice in Central Mass. And I'm also the mother of 3 small children.
Awesome. So we have another great episode for you all today, but before we get started, a couple of required reminders. Anything that any of us or our guests or any participant say about anything in this conversation should not be taken as medical advice. Always consult your own healthcare professional for questions about you or your baby's health. And the opinions expressed in this conversation are personal to the host, guests, and any participants as well, and don't ever represent the views or policies of any current or former employer, including hospitals or clinicians. Our conversations are done on a HIPAA-compliant platform versus the level of Zoom. And for a full review of our disclaimer, please visit babiesincommon.com/disclaimer. Second, this video is interactive, and if you'd like to ask a question, use the clapping emoji reaction at the bottom of your screen. You could also unmute your video, wave to us, or type your question in the chat box. You also can type it as an anonymous, like not to everybody, so everybody doesn't have to see your question. So that's another way to ask a question.
Awesome. Thanks, Jeanette. Now on to our show. Today is May 13th, 2020, and today we'll be discussing vaginal birth after cesarean, also known as VBAC and sometimes called TOLAC, by obstetrical providers, which means trial of labor after cesarean. But I think people should not be made to feel like they are on trial when giving birth. And so we're going to use the more optimistic and goal-oriented term VBAC in this podcast. We are joined by 3 local moms who will speak about their experiences learning about, preparing for, and ultimately having a VBAC birth. We will discuss how to tell if your provider or hospital is truly VBAC supportive, the research on VBAC safety, and obstacles you might face and how to overcome them. So our first guest is Linda. Hello, Linda. I met Linda through my sister when we were all in college. They both were members of the Pride in Class of Massachusetts, the UMass Amherst Marching Band Color Guard. So whoop, go Minutemen. And Linda holds a degree in psychology from UMass and is a small business owner, talented cake decorator, and mother of 2 young children living in Central Mass. She had an unexpected cesarean birth for fetal distress during a medically indicated labor induction for the birth of her son in 2015. And then she had a successful VBAC with her daughter in 2017. Our second guest, Heather, welcome Heather, is a beloved longtime member of the Babies in Common community. I met her back in Breast Milk and Conversation when our 7-year-olds were little teeny tiny babies. Heather holds a degree in Human Services and Rehabilitation Studies from Assumption College and is the mom of 2 young boys, also living in Central Mass. Heather experienced a very rare pregnancy complication that led to a truly emergent cesarean delivery of her son in 2013. She then had a successful VBAC for her second son in 2019.
And our third guest is Chelsea Levine, and Chelsea's another longtime and beloved member of Babies in Common community, and she's a licensed social worker who specializes in trauma and is currently working as a program director for Community Health Link in Worcester, where she provides clinical services to a high-risk population of folks with severe mental illness. She's also a very talented photographer and even did a project on boobs, which we're very excited to see someday come out. Yes. Chelsea had her first traumatic cesarean experience after 69 hours of labor with her first child, who just turned 7. And she then had a successful VBAC for the birth of her 4-year-old daughter, which she describes as the single proudest moment of her entire life. So thank you, everybody, for joining us today.
Yes, thank you so much. I think we should start off with Linda. So Linda, do you think you could give us a brief description of the situation surrounding your first birth with your son?
Sure. So obviously he was my first child, and I was living in the South Shore at the time. And I had not ever planned for a C-section. That was not something in my brain. So when it got to about 41 weeks, I went for the 41-week appointment. We had an ultrasound done, and they decided that I didn't have any fluid left and that I needed to go be induced. I never actually got to the induction point of that. They inserted the cervidil sorry.
Yeah,
Yes,
you
that's
had
the
it.
right word.
That
It's
is
been
correct.
so long that I'm trying to remember.
Yeah, that's a
And
cervical ripening to kind of get your body ready for the induction.
yeah, so that was their first step. And they told me it was going to be for about 12 hours. Well, they actually had to take it out after 15, 20 minutes because I had a really, really bad reaction. I was vomiting and passing out, and I basically had a 6-hour contraction that they were trying to then stop.
Oh.
I got to about 6 centimeters in the course of about 12 hours. They then decided I, at some point, got an epidural, which was not part of my plan, but at some point it happened. And they decided that I needed a C-section because his stats were dropping and they thought the cord was wrapped, which it was. So um, he didn't have any complications after that until a few days later, which were not related to the birth, but he did end up in the NICU at some point. But yeah, that was my C-section.
Wow, it is really hard to go into an appointment and expect just to go home to be told, hey, you need an induction, to go into the hospital to be told, this is going to take 12 hours, and then all of a sudden you're in labor. I remember you telling me that they actually sent your husband home, right? They're like, this is going to take a long time.
They did. I had a relative and a best friend with me, so they said this is probably going to be a few days. Like, why don't you go switch out and tag team? And he wasn't even in the door by the time they called him and told him to come back.
So can you tell me a little bit about your recovery with that C-section experience?
The recovery actually wasn't that bad based on some other stories that I had heard. The biggest thing for me was one of the internal stitches actually made its way out, so I had to go get that removed. But I had a lot of support, so like I didn't have to go out, I didn't have to drive. I was part of a breastfeeding support group at the hospital where I birthed him, and I got, rides back and forth to that. So um, the recovery was actually a lot easier than I had anticipated.
That's good to
Painful,
hear.
but
I think the support is the key with that too, right? You did you have family support or did you hire some help?
I had family support. My mother-in-law would travel out a couple days a week, and my mom was not working at the time down the street, so she was there often.
Wow. I wanted to add one more thing just related to that induction, where people, I've heard so many times, I'm sure many of us have, where someone will say, oh, well, it's probably going to take this many hours, and then it doesn't. So it still floors me that I am not somebody who works in a hospital. I mean, I was a doula, so I got to be with people in labor and beforehand, but you would think people who work in hospitals full time would know that sometimes labors go quick after you do these interventions, but they keep saying, oh, it'll take a while.
I think there's a fine line between setting up realistic expectations. Some people come into the hospital expecting a baby by the afternoon, and so we have to help them understand this could be a multi-day process. But on the flip side, I never tell the partner they can leave because I don't tell them they can leave in labor. I don't tell them they can leave postpartum. I'm like, and honestly, it's not even the partners that are usually the culprits. It's the birthing person that's like, oh, you go home and sleep in your own bed. Take care of the dogs. And I'm like, no, you're gonna need the help, you know?
All three of
So
my support team told me that I agreed with him, but I don't even remember it because those first 12 hours I was just completely out of it. But I'm sure I did say that.
right? Anyway, so when you got pregnant with your daughter, did you already know about VBAC and how did you learn about it?
So I actually did already know about it. Back 30 years ago, my brother-in-law, so my husband is the oldest, he was a very traumatic, like 3-day long birth, emergency C-section, like they cut her open in the hallway, like very bad. And my brother-in-law was actually a VBAC 30 years ago. So I actually had spoken to my mother-in-law about it. And obviously friends with Melissa for years. So I've seen things that you've posted. And your sister, Marlena, would talk to me about stuff, especially after I got pregnant. And I actually have a close friend out in Minnesota who is now a certified midwife. So we talked about that too.
And so could you talk a little bit about our playground date and how that unfolded, because you had heard about VBAC, but I remember you reaching out to me saying, "Hey, my sister Marlena keeps telling me I need to talk to you." And I was like, I would talk to anybody about birth. I talked to everybody about birth. So I was like, yeah, let's, you had a toddler at the time, Liam,
Mhm.
and I had Pierce, and so we went to Rocketland and let the kids play. And could you talk a little bit about what that conversation was like?
Sure. So I really wanted to speak to someone who I knew was educated, who I knew could also be non-biased one way or the other. And obviously I trust you and Marlena, and so I reached out to you. And we went to the park, and I think, if I remember correctly, some of my biggest concerns um, were not being able to have the VBAC, like trying for so long and just ending up in a C-section. Um, I didn't want to go through all of that again because of the trauma and not even remembering parts of my first birth. I I didn't want to feel like a failure, I guess, going through all of that. And I remember one of the biggest things we talked about was all of the benefits of birthing, even if it did end up in a truly needed C-section. There are benefits that you get from the birthing process. I specifically remember the lungs. We talked about the lungs and the breathing issues that are higher in C-section babies. So that was part of it. I think recovery was another part because I did have a toddler running around, and I didn't want to have to be out if I didn't have to, like laying on the couch. The first recovery wasn't bad, but I couldn't remember, or I couldn't imagine doing that with a child. And also, the support team had changed because I was now living in central Massachusetts. My mom was not down the street. She doesn't drive on the highways. My mother-in-law works. So I didn't have quite the same support system. I knew I was going to be on my own a little bit more. Um, my husband can take time off, but he's an accountant, and both of my kids were born right before tax day. So March 30th
Bad
and April
timing.
15th. Yeah.
So yeah, and what Linda is talking about the lung thing, and I always make a point when I took care of patients as a labor and delivery nurse to mention this to anybody who had a labor and then a cesarean birth, is sometimes it can feel like, why did I go through all of this, right? Why did I just labor for X amount of hours to end up with a cesarean birth? But the process of labor, so when a uterus is contracting and a baby is getting stressed, and I mean that in a good way, a good stress. Babies are built for the stress or work of labor. When a baby is getting stressed, quote, by the uterus contracting, that actually causes their body, their lungs, to secrete chemicals that get their lungs ready to breathe on their own. And so there's this phenomenon that can happen most often in cesarean births where there has not been labor. So a scheduled cesarean, for example, or with very, very quick deliveries, like a mom who just like blows out a baby. We call those drive-bys in the hospital. It's something called TTN, which means transient tachypnea of the newborn. And transient meaning doesn't last forever, comes and goes. Tachypnea meaning fast breathing of the newborn. And that's because the baby still has a lot of fetal lung fluid in their lungs that wasn't really stressed out by the labor. And if they that had a cesarean birth, even more so, they weren't even squeezed out of the vagina. But even if they weren't squeezed out of the vagina, the stress of labor actually helps babies get ready to breathe on the outside. So that's what Linda was talking about when I said, as much as it might seem why I'm a failure for having to have a cesarean. Nobody is a failure who gets a baby from inside of their body to outside of their body, just for the record. That is superhero status. But I love to remind patients and educate patients, you have done so much good help to your baby by going through that labor. Wow, you are amazing for doing that and then still having to have a C-section. So that's great that you remember that, because that's something that I hope helps a lot of people, process their cesarean birth. Do you meet any resistance to your decision from your partner or your doctor?
No, my partner, Mike, he was very much on board. I think knowing that his mother went through the same thing, and, he saw what I went through the first time. The C-section, the after part, that I feel like we talked about the physical part, there was a lot of mental work that had to be done there too. So he was very much on board. My provider at the time, I actually was looking for a new provider anyway because I had moved. So I actually ended up with the first person that I interviewed with, which was the word they used. They told me to come in and we would talk. And I loved that because back home we didn't have that. Like I never had that. She scheduled, I think it was like an hour and a half just to talk to me about my past and where we were going and what I wanted to do. She showed me some of her stats, like based on like not just successful VBACs, but the amount that she had tried versus success, which I really liked because anyone can say, oh, I have this much success rate, but it's like, well, how many did you attempt versus actually like occurred? We talked about the possibility that even though she was my doctor, she may not be on call at the time, and other people in the practice might not be as willing to continue if anything started to go the other way. But overall, I felt very supported by her and her staff. She used the words perfect candidate. So I was like, all right, I'm in. She just made me feel really comfortable through the whole process.
That's awesome.
Awesome.
And there's a lot of discussion in the OB world about who's a quote candidate for a VBAC, and there's a lot of misunderstanding about that. There's a lot of physicians who will counsel that you're not a quote good candidate if you had a cesarean for some type of what they call labor dystocia, which means a labor that does not, that stalls or slows, or someone who pushes for a long time, the baby quote doesn't fit. They call that in the biz CPD, or cephalopelvic disproportion, which basically means head through pelvis, no bueno. So, but what we know now, especially with Gail Tully and Spinning Babies, which we have a wonderful Spinning Babies instructor, as well as Jeanette Sherry McBurney on the call today, is that just because a baby, quote, didn't fit during a first labor, because labor stalled or labor was dysfunctional, or mom, or birthing person pushed for a long time and didn't successfully push the baby out of their vagina, it's not just because baby was too big and mommy was too small and her pelvis is broken and her body is broken and she can't give birth, because it's as much about the size of the baby and the size of the pelvis, but even more the way the baby's entering the pelvis, and different soft tissue restrictions within the pelvis, ligaments and whatnot, that can hold up the baby from getting into the best, most optimal position for birth. So if you are a pregnant person listening to this podcast, I highly recommend checking out spinningbabies.com and considering doing some of their daily exercises and learning about that philosophy, take it with one of our Massachusetts Spinning Babies instructors, because the old idea was once cesarean, always a cesarean, but there are very, very few people who are not truly medically a quote candidate for a VBAC. If someone has a classical incision on their uterus, which means up and down, where the incision cuts into the fundus, or the thickest part of the uterus where the contraction bunches up, that is a higher rate of potential uterine rupture, which is the stat that they like to talk about. But even if it was somebody who had a long labor, difficult second stage, pushing stage, it could all just be a baby, different birth, different labor, different position, and everything could be completely different the second time. So awesome. I'm glad she was supportive by, I like to tell people actually at their first birth that they're an ideal candidate for a VBAC, because I feel like that sticks in your mind, right?
Right.
So how was your VBAC experience?
It was the most empowering thing I've ever done. I do remember at one point I was screaming at them to just cut me open. I'm very glad. I am very glad she was already halfway out at that point, because they were like, there's no turning back. But it was almost the same amount of time, which I find very funny, because they were two completely different experiences. I woke up on her due date, my water broke, dropped my toddler off at the daycare next door. Off to the hospital we went. Check-in time to 12 hours later, she was in my hands. I think I pushed for less than an hour, and it's so much that the doctor almost wasn't in the room. I remember the nurse telling my husband, I hope the doctor gets here soon. I've never done this by myself.
Wow.
And I'm pretty sure I asked for a new nurse. but it was her. She was there. But yeah, it was just, you know, a couple pushes, and then she was out and in my arms, and I just remember crying and looking at my husband and just screaming, "We did it." And he was like, "No, you did it." And I was like, "No, we did it. Like, I wouldn't have been here without you." Like, the support from him throughout the whole thing really, really, really helped, because I think if I was fighting for that on my own and he wasn't like backing me, I would have probably given in more. But yeah, I still get teary thinking about it.
Yeah, that's so true. I want to also highlight that there are two ladies on this call who don't have to identify themselves if they don't want to, but I love that you're in the car listening together. It's very sweet. Drinking your coffees, having a good time. Very fun. Awesome. There we go. All right. So, do we have anything else for Linda? Anybody else have a question for her?
Pretty straightforward.
It is, and I think it's just such a shame that so many people are discouraged. You know, the stats are generally that 80% of people will be successful when they're to have a vaginal birth after C-section, but so few people are encouraged to do that because they go back to the same provider usually, or they happen upon a provider that says, "Well, we'll try, we'll see," but they're not like they don't have a reputation as a provider of being a tried and true provider that really works hard to try to help their clients have a VBAC. And also, even the fact that you said that your doctor said, "Well, I can't promise that everybody that you'll see is going to treat you the same way," which is always, I know that's true, but it's just horrible that that's the case.
Yeah.
Like we should have a more cohesive approach across the whole system based on evidence and based on what's going on in your specific labor, you know? So good for you. You did it. And you know, that's great. You made the effort and it worked out. And that's all, you know, if that's what you want, that's a great thing to do, right? So
Yeah.
success.
What surprised me the most was how many people have never actually heard of a VBAC. I think, I don't know, knowing that my mother-in-law had one back, 30 years ago, and just kind of, it was always something I kind of knew about. Even when I posted about this podcast, I had people text me like, "What is a VBAC? Oh, I didn't know you could do that." Like, they just have it in their brain that once you have a C-section, that's it. And that saddened me so much. I'm like, and if that's what you choose to do, and if that's right for you, that's one thing, but you should know that there is another option.
Absolutely. Do you have any advice for anybody that might be pregnant again and have the history of a cesarean? Do you know anything that maybe helped you make your decision or helped you get through that experience? Because going, like you said, when there's a vaginal birth after cesarean, that means there's a first birth. And whether that first birth was a C-section or a vaginal birth, sometimes there's some humps, emotional humps you have to get over. So do you have any advice for the listeners?
I think definitely just reach out to someone. In my case, I really wanted someone that wasn't someone who was going to be one of my providers, someone who didn't have an agenda one way or the other. And I did also talk to a therapist about my first birth as well, because it was something that really just shook me to my core, that it didn't go any way that I wanted it to. And I know you write your birth plan and, people laugh at that because whatever, it goes every which way you want it to. But I don't think I had much say in it the first time. And I think just talking to people and knowing my options, and having supportive friends outside of my husband, I think really, really, really helped make the difference.
Absolutely. So should we talk to Heather now?
Hi.
So hello. So Heather had a very rare, truly emergent complication, and you can share however much you would like with that. But you also waited a long time to have another baby. So whatever you'd like to share. I know your story. I've heard it many times, but
Yeah.
start with, with Will's birth a little bit, whatever you would like to share, and that process of making that decision over those years before you had your second son.
Sure. So I had my first 7 years ago, almost. I took childbirth education classes at Babies in Common. I felt super prepared. I remember part of the story that I tell every time is that even though I was doing a natural childbirth ready class, part of that class was going through what would happen if you had a cesarean. And one of the things that you said, Jeanette, was that is not truly an emergency section unless everyone on the floor is in your room. And I felt, even though I didn't want to have a C-section, I felt like I know what's coming now. So when I was 39 weeks pregnant with my first child, I went in for my 39-week checkup. It went fine. She checked to see if I was dilated at all. I was maybe a centimeter. She left. I got dressed, and as I stood up, I dropped about a grapefruit-sized clot on the floor. So my husband went and got the doctor. She said, "You're lucky I didn't ride in an ambulance with you to the hospital." I was monitored for a while. I stopped bleeding, got an ultrasound. The OB who gave me the ultrasound at the bedside said that everything was fine. I had plenty of amniotic fluid, but that they were probably going to look at inducing me. They decided to do one more ultrasound down in radiology. I had that, and they said, "You have no amniotic fluid, so now we need to induce you." My doula happened to be in the hospital around the corner from me because one of my friends was having a baby the same day. She came over, we talked about what we wanted to do, if I wanted to leave against medical advice, or if I was going to stay. As soon as they say that your baby could be in trouble, you'll do whatever they say, which is what happened. So I stayed. I was getting induced. I had moved 2 days previously, which don't ever do that, right around your due date. But I had moved, so I didn't have any bags packed. I didn't know where everything was. My parents ended up going in all the different boxes and finding everything. I had misoprostol placed, which is a cervical ripener. And I was going to have that done every 4 hours. My doula and an apprentice doula left. My doula's son was graduating from high school. She left to go have dinner with him. As they say, inductions can take 3 days, so we were ready to wait it out. I had the second dose of misoprostol placed at 10 p.m. My husband and I had just settled into our nice comfy twin bed to sleep for the night, and I felt a pop. So I stood up and I started hemorrhaging. There was blood everywhere. It hit the floor so hard that it ricocheted 5 feet up onto the wall. My husband called the nurse, who called all of the other nurses, who called all of the residents, who called all of the attendings. And then I knew it was an emergency C-section. My husband, oh, the poor thing, he was like, "Maybe this is bloody show." And we were like, "No, it's not." So I started going,
what a sweet man.
Oh, we'll never live it down. I started going into shock a little bit from blood loss. I ended up with an emergency C-section. Nobody made it in time. They left my husband in the room to get the Tyvek suit on. He put a hole through it, and he said when he looked up again, I was gone, and he was in a room covered in blood, and he didn't know if he'd ever see me or our child. So we had our son. My recovery was, I think I just powered through it. I was like, this is not what I wanted, so I'm going to do everything I can to be better as soon as possible. I was off of pain meds within 12 hours. We stayed for the 5 days, mostly because people were unpacking our house and we couldn't go home before then. The recovery was okay. They did take my son to the NICU for a second just to get checked out basically, and then back. My husband, it was incredibly traumatizing for both of us. My husband really felt like he would never see me again when I got wheeled away to the OR. and didn't think that he'd ever meet his son. And as such was kind of like, I don't think I want to have another baby, because I can't go through that again. I still wanted another baby, mostly to show myself that I could do it, because I felt like my body failed. Like I felt like something that I did was wrong, which I know intellectually is not true. But it was really hard to wrap my brain around that emotionally.
So Heather, before we continue, can I just ask, did they diagnose you with an abruption? Is that what the diagnosis was?
So they did I don't know what it's called, when they do a postmortem on your placenta, but that's what they did.
Pathology, yeah, they sent it to pathology.
Pathology, thank you. Yes, that's it. So it's either a placental abruption or a vasoprevia.
Oh, okay. So just for our listeners, a placental abruption is when the placenta starts to detach from the wall of the uterus. And sometimes that is a concealed abruption, and some meaning that the blood is walled off by the other parts of the placenta that are still attached to the uterus. And if the abruption is small enough, some people can have some bleeding. That's what brings them into the hospital. But if the baby is tolerating labor, we can still continue to hope for a vaginal delivery. And if the baby takes a turn or the bleeding increases or the mother is no longer stable, then a cesarean can be done. A vasoprevia is totally different. So, that's kind of an abnormal placenta and blood vessels that are going through the membranes, which is the bag of waters. And if that bag of waters breaks into one of those blood vessels, that's where that hemorrhaging can come from. So both are incredibly rare. I know it's really scary to hear stories like this. But I was just curious because, that to have that much bleeding right away is kind of one of those, like, I can count on just one hand the amount of scenarios I've had like that in my 14 years as a nurse. So I'm really sorry that is absolutely traumatizing. I mean, and as much as nurses try to remember the partner in the room, sometimes there's not enough staff on the floor. Everybody's in the OR. And it has been said time and time again by partners, like, I really didn't know what was happening. So, everybody in the hospital, if you're a birth provider, needs to be aware of that as well, that someone needs to go and talk to the partner and let them know, what's going on, because I can only imagine being in that situation. So I'm sorry to interrupt. Please continue.
No, that's fine. He actually ended up having to ask a member of the cleaning crew to get him another suit so he could come into the OR. So it took me a really long time to convince him that we should have another child. And then when we did, it just didn't happen right away. So there are 6.5 years between my two kids. I did see a therapist, and I still do see a therapist to deal with the trauma of the birth. We dealt a lot with the trauma of my first birth in getting ready for the second birth. My doula came in. I had the same doula for the second birth as for the first. She came into therapy with me, actually, and went over the first birth to see what might be a trigger or something that might set me off for the second birth. I switched providers. I switched hospitals, actually. And I went with the midwives in Worcester, the hospital midwives. I wanted a chance to use laughing gas. I can't remember what it's called.
Nitrous oxide.
Nitrous oxide. Yeah, I wanted a chance to try that instead of having pain meds. I know that you can start down a path of interventions, and then it can kind of spiral out of control. I just wanted to try to avoid that. So I wanted the midwives. I really wanted a home birth, but I was too afraid. And immediately following my first son's birth, basically every midwife I talked to, home birth midwife, said that nobody would touch me and I would not be able to have a home birth. So I planned to labor at home for as long as possible. I had a tub. I was ready. I thought that my water broke the week before my due date. It was my son's water bottle that was leaking down my legs, so that was not it. But I went in for my 40-week checkup. They'd been saying for 6 weeks probably that we should schedule my C-section and schedule my induction. And I was like, that's not my plan. I am having a VBAC. I am not going to schedule anything. I don't care if it makes it more convenient for you. It is not happening. I am over 35, so I was high risk because of my age and because of my previous birth experience. And they just kept pushing the induction, the scheduled induction, the scheduled C-section, and I kept refusing. I said, if I make it to 41 weeks, then we can talk about scheduling induction. So I went in for my 40-week, which was really, my 39-week, which was really 39 and 6. So my blood pressure was high. I had no other markers that showed that anything was wrong. I was super anxious because I knew that I was going to see an OB and not a midwife that day. And they had already tried pushing me to schedule a C-section and an induction. So I knew that was coming again. I was afraid because I was seeing a more medicalized professional. So my blood pressure was high. I called my doula and my husband, decided that I would go get checked out. My blood pressure remained high. Who knows if it was anxiety or whatever, but it remained high. I had quite the birth team. I had a doula, I had my husband, my mom came. My parents were taking care of my older son, but she came once I was actually in labor. The first thing that they tried was a Foley bulb induction. So they inserted a Foley bulb into my cervix and filled it with saline. That stayed in for 12 hours, may or may not have helped some. Then we started with
trying to remember.
I can't think of
Pitocin?
Pitocin.
Yeah.
Pitocin.
And the reason why they did the Foley bulb, which can be used for any induction, but the reason why for you they started with that and not something like misoprostol or Cervidil, which you had described in your first birth and Linda had mentioned, those medications are synthetic prostaglandins, and they have shown to increase rates of uterine rupture from women who have a previous uterine scar, whether that's a fibroid surgery or a prior cesarean. And so if any cervical ripening is needed, which anybody who takes a good quality childbirth class knows is an important thing to happen before you give Pitocin, to get your cervix ready for labor, the Foley bulb that you're describing is essentially a flexible silicone catheter that is about the width of a pencil that's inserted into the hole of the cervix. And then there's a balloon that's like inflated with saline, about 60 milliliters of saline or whatnot on the top and sometimes on the top and bottom of the cervix. And what that does is it irritates the lining, the mucosa of the cervix to release your own body's prostaglandins and also kind of mechanically put pressure on your cervix to thin and open. So that is something that can be used as a first step for someone who has a previous uterine scar. So they did that. It may or may not have helped. Then they started the Pitocin, you said, which is that synthetic oxytocin, which is run through an IV.
Right. So they actually wanted to start with the Pitocin, and I pushed for the Foley bulb.
Yay!
Yay. I wish they would use that Foley bulb more.
What's that?
I wish they would use the Foley bulb more.
Absolutely.
Yeah. So before we started the Pitocin, I talked to my husband and my doula a lot. We went out into the atrium and walked around for 2 hours, and they had to call us to ask us to come back in because they didn't know where I was. So we told
good for you for taking the time you needed to think about it, and by leaving the room, that's a pretty good signal to everybody that you're going to take your time to think about it.
Right. Right. So we came back, decided to do the Pitocin. I said, I want to start at 1 and I want to go up by 1. I do not want to start at 2 and go up by 2.
Nice.
So we did that. Chelsea actually came. She was the photographer at my birth. So she came, did the induction. By like my first son came. I said goodbye to him, and wow, labor kicked into gear. He left, and within like a half an hour, I was in labor. It was intense. And I kept saying to everyone, I was like, why do people do this more than once? And why did I want to do this? This was a terrible idea.
And you've been waiting so long to do that and begging for that.
Wanted it so badly. And
very normal. Very normal.
So I went fast and furious. I was supposed to not be eating anything, and it had been 36 hours at this point since I got admitted. I didn't exactly listen to them. I had
They should not be telling you that you shouldn't be eating, by the way. You had no epidural. You didn't have a plan for an epidural. Like, the evidence is that you should be eating if you want to.
Right. And that's what I knew. So I had a piece of pizza, I had some fruit, and I had a few pieces of chocolate. It all came back up. And so then everyone knew that I had been eating.
Chelsea, did you get a picture of that? Did you get pictures of the vomiting? Oh, we can't hear you.
I was just gonna throw in there, it was hilarious because amidst these extremely intense contractions while we're, rubbing her back, holding the bowl, she looked up at me, this woman's giving birth, and she's like, great, now they're gonna know I was eating. And it was so funny because that was her concern, was like, they're gonna see literally everything, now they know. And it was hilarious. I was like, at least you still have your sense of humor through all these contractions.
Yeah, it was not my favorite. So I was like, I can't do this. I need something. I asked for the nitrous oxide. I am also a trauma survivor. And I tried the nitrous oxide and I felt completely out of control. It terrified me. I fell apart. I started sobbing. And I asked them to take the nitrous oxide out of the room. I didn't want to see it. I didn't want it to be around me. I felt totally out of control. So then I realized—
Heather, just to clarify, was it the nitrous oxide itself or was it the mask on your face?
It was the nitrous oxide itself.
Okay.
I felt high and I felt out of control of my body.
Okay.
And I didn't like that. Having talked to people afterwards, I probably could have breathed in a little bit shallower or not right away. But the idea of doing it again was too terrifying to keep it in the room. So I decided that I could not deal with the contractions for much longer by myself. So I opted for an epidural for like 2 hours, and everyone was like, you're doing so great. You have gone 6 centimeters or 4 centimeters in 2 hours or something. You're fine. You can do this, because I really didn't want an epidural when I started. And then I really did want an epidural, and nobody believed me. And I was like, here's my 2-word phrase.
I was just going to ask
me
you,
an
used your two-word thing.
I used my 2-word phrase like 100 times.
Ooh.
And 2 hours later, I got an epidural. It was going so fast that everyone was like, I think that if we just wait another hour, she'll have this baby. And I was like, no, give me the epidural. So I had one. I asked them to stop the Pitocin during the epidural because I had to stay still, and I didn't feel like I could do that with the Pitocin running. They ended up not restarting the Pitocin until 7 a.m. That was 7 hours after I got the epidural. I did not have any contractions on my own. I was not in labor on my own. The Pitocin was the only thing that was contributing to my labor. So At 6:45, the midwife who had been on for the previous 24 hours came in and said, "You've been stalled for 7 hours, but that's to be expected because you haven't had Pitocin for 7 hours. We'll put you back on. You'll go back into labor. You can have this baby." And then at 7 o'clock, the next midwife came in and said, "You've been stalled for 7 hours. You're not in labor on your own. You're going to have a C-section." And I was like, "What?
Ooh, snap.
What changed?" And apparently what changed is the OB on call. And he decided that because I was not in labor on my own, and because of my age, and because of my previous birth, that I needed to have a C-section.
But just for the record, you weren't in labor on your own. They induced you. So that should be expected, meaning it's an added bonus if somebody who was induced then kicks into their own labor. Otherwise, it should be expected that someone who was induced needs the help of the induction agents for the entire labor. So what a manipulative thing to say. Oh, my Lord.
Yep. I was furious. I'd done a lot of reading about VBACs, about the risk factors, about what increases and everything. So I told her that I was not ready to talk about a cesarean. She told me that the OB was going to want to talk to me. So I said, fine, he can come in. He came in. I was naked and on my hands and knees with an epidural with my doula. And she had a sheet that she was jiggling back and forth over my hips. And he came in and stood by the curtain, not facing me, and told me that I was going to have a C-section. And I said, "That's not what I'm going to do." And he's like, "Well, you're stalled." And I said, "I know, because I haven't been on the Pitocin." And he said, "Well, you're at an increased risk for an anal fistula and your baby's going to die." And I was like, "Well, based on what?" And he said, "Because you are a VBAC, because you had a cesarean before." And I said, "That's not true." What was hysterical to me was that my doula had said, "He's going to come in and tell you that you're going to get an anal fistula and you're going to kill your baby." And he did. And I looked at her in awe. I was like, "How did you know that?" She said, "He's been saying that to everyone for 20 years.
And that's not even true. That's not even true.
No.
I know, out of all the things to say, anal fistula would not be the thing that I would say is a risk of a VBAC. Like, I mean, wow, that's just an interesting choice.
Yeah. So I said, well, I'm going to wait 2 hours and I'm going to give my body time to see if it will, if I can get back in, and if I will, I don't know why words are failing so much today. If my cervix will continue to open on its own, well, with the help of the Pitocin and no C-section. So he said, "Well, good luck. It's not going to happen. And I hope you don't die," and walked out of the room and left the C-section paperwork on the counter in the room and told the anesthesiologist to get the room ready for me. I waited 2 hours and I was fully dilated. I was sick when I was in labor, so that was fun. I couldn't breathe through my nose, which probably was helpful because it helped me do some low, deep breathing. I had the midwife check me probably an hour after the 2 hours was up, and I was ready to push. I pushed for 21 minutes and I had my second son.
Wow.
Thanks.
21 minutes. Damn.
20. Yep.
Did you have the opportunity to maybe flip the bird to this OB on your way out?
I did not. I really, really, really wanted to see him and tell him what I thought. I still am going to probably send him a picture as close as I can of my baby coming out of my vagina, with a very not so nicely worded letter about where he can go.
I think everybody should plan to write those letters. If they're happy with what happened at their birth, write a letter. If you're not happy, tell them why.
I
was
agree.
actually
And there's so many myths that came up in your birth story that we don't even have time to go into, but I highly recommend anybody that's interested in a VBAC visit ican-online.org, the International Cesarean Awareness Network, because these ideas of, quote, you can't go past your due date because you're a VBAC, or you can't push for insert random amount of hours because you're a VBAC, you can't labor for random amount of hours because you're a VBAC. These are all you have to have an epidural because you're a VBAC. You can't have an epidural because you're a VBAC. These are all VBAC myths. And the ICANN website goes into, great FAQs about these types of things. So I highly recommend, because there's so many in your story. And what you're describing, this physician that is telling you only the most extreme risks of a cesarean, of a vaginal birth after cesarean, and mentioning none of the risks of a cesarean, that's actually called coercion, and that is actually illegal. But too many people get away with it. That I hear that all the time. We actually have a name for it in the business. It's called the dead baby card, and it's a terrible, terrible thing because too many people drop that. If you don't have X intervention, you're going to have a dead baby. And while all medical interventions that we have in obstetrics have life-saving potential for sure. I am eternally grateful to be living and working and birthing in 2020 modern America with access to all of these technologies. The reality is that, just mentioning that to somebody in labor who's already in a vulnerable place is coercion and is traumatic and is verbal assault. I mean, it's not what a good practitioner would say. I'm really sorry that happened to you, and I'm really proud of you for being able to advocate for yourself in labor, right, with your butt in the air, getting jiggled by your midwife, right? I mean, that's pretty badass, Heather.
and Heather didn't even, Heather, you've told me this story before, but you didn't quite give us the inflection of how you spoke to him. Because I remember when you told me the story, and then I've heard it a couple times since, I was like, did you really say it like that? She's like, yes, I did. And I was like, damn, girl.
Well, he said to me, he said, you are at a higher risk. And I said, because I'm a VBAC, because I had a cesarean? He said, no, because your risk of uterine rupture goes from 0.5% to 1.5%. I said, so I am fine with that risk, and I will take it, and I will continue. And he said, no, you particularly are at a higher risk. And I said, why? And he's like, because I said you are. And I was like, all right, bye.
Good for you.
She was quite the badass. I was so impressed and just proud in that moment, because knowing her first birth and knowing her fears about it, and it was just really powerful to see him come in here, swinging things around and trying to be, hey, this is what's going to happen. And she, without batting an eye, was just dropping stats. She's actually, correcting this doctor. She's actually, it's 1%, 1 to 2%, whatever it was. It was so minuscule. She's I'm willing to take that risk, and just fired off these facts and stats. And he was like, all right, well, good luck then. And I was like, yes, love clap, because you just totally stood up for yourself and put him in his place, which is really hard to do to the doctor when you're when you feel like he's saying you're at risk. Crazy. Really
hard to do. It's really intimidating. And, there's a couple points in here I'd like to highlight. One is that you as a birthing person get to make the best decisions for your body and your baby and your birth. And you have the right to determine what risks you are willing to take. There are risks to everything. There are risks to vaginal birth. There are risks to cesareans. There are risks to vaginal birth after cesareans. And to only present one side of the story is wrong. And it's not, anybody else's decision, because as I like to remind parents, you live with the consequences of your decisions, not the doctor, not the nurse, not the midwife. You're the one that lives with the physical, mental, and emotional ramifications, and therefore the decision should be yours about what risk you're willing to take. And for some people, they might not want to take the risks that you took, Heather. They might want to say, I just want to plan cesarean. If that's going to give them a positive and empowering birth experience, then let's do that, right? But kudos to you for doing your research and hiring a doula and having the support, to pull that off, because, it's hard enough to get through the emotional hurdle of having a VBAC, never mind with a traumatic cesarean, never mind with a hostile, hospital staff. That's wow. I'm just in awe of you.
Another thing that some people don't realize is that there's also, with your risk of vaginal birth, risk of C-section, risk of VBAC, is there's also progressively more risk for each C-section in and of, just for the C-section itself, but also the fertility of the person having multiple C-sections. That can be complicated. It isn't always, but that's one of the associated risks of a repeat C-section that a lot of people aren't ever told about. And then they have a hard time getting pregnant. And you realize, oh, maybe it was because I elected to have a C-section and nobody told me that that was a possible risk. So it's just so important for people to know all of the risks and benefits, because sometimes you may need to have another C-section, maybe a fourth or fifth C-section, because you have a real reason that you need to have those. And so then we want to talk about minimizing the risks of that surgery. But to not know that that's the option before you go down that lane is really frustrating. Yeah. Well,
Heather, do you have any advice? Oh, I was going to say, Heather, do you have any advice for anybody that might be considering a VBAC as someone who had to make that decision?
I would say get a doula. Do lots of research about actual facts. Make sure you ask your provider what their VBAC rate is, what their cesarean rate is. Try to make sure that that everyone in the practice will be about on the same page. Know what you want, stick to your guns. It's overwhelming in the moment, but make sure that your whole support team is on the same page too.
Both you, Heather, and Linda talked about this idea of having a non-biased professional to bounce your ideas off of, whether that's a doula, your childbirth educator, or your best friend's sister from college, who happens to be a labor and delivery nurse. I think it benefits every birthing person, every pregnant person, to have education, informed, unbiased, evidence-based education. So yeah, awesome. What about, should we go on to Chelsea, Jeanette?
Yeah.
So Chelsea, can you give us a brief description of the situation surrounding your first birth?
Yes. So 7 years ago, I was 42 weeks pregnant with my son, Isaiah. I had a pretty normal pregnancy, polyhydramnios, so I had a lot of extra fluid. I was large and in charge. And I went into labor on my own, which is good because I was getting right to the end when they were going to say, all right. And I want to just say, without getting too far into it, that because it's a large part of my story, is that I was going through a lot of personal struggles in my marriage, and a lot of fear and safety concerns. I had separated from my husband, and he was dealing with substance abuse and a lot of significant issues that caused me to be very uncertain about my life and what it was going to be like, and bringing a child into the world. And so while he was there for the actual birth, I was very much alone and afraid in that birth. And I think that's important to talk about because I think it played a big role in what ended up happening. But anyway, my labor ended up being 69 hours, actually 69 hours, not like having a couple contractions and you think you're in labor, but I mean like active labor from the point of when they were 5 minutes apart is when I'm counting from, literally 69 hours. which was exhausting because I couldn't really sleep. And I went into the hospital and they were like, oh, honey, no, you're not dilated. And I was like, okay, I'll just go home. And I came back in and I was like, I know this is the time. I've been in labor for so long. I know I'm ready. Just show me I'm ready. Tell me. And they were like, no, just the 1 centimeter. And I was like, okay. So I had a lot of that going on. So when I finally came in, I think I was so delirious and emotional, and it had been such a long labor that I think they were like, we're just going to admit her for her mental health, because I think if we send her home again and tell her she's not leaving with this baby, she might need to go to a different ward. So we're going to go ahead and keep her. So they did. And they ended up giving me, I said, was it morphine? They gave me something to sleep. I think they were trying to just let me calm down. I hadn't slept in now 2 days.
Probably morphine. That's what we call therapeutic rest.
Yes, that's what it was. That's what it was. And I was like, sure. And so they gave it to me. And I think that I had been so stressed and anxious that nothing was happening. And when I woke up, by the way, my contractions, I just want you to know, they told me that I wasn't going to feel any contractions when I was on this morphine. And I was like, woo, because they were so painful. And I promise you, I was high as a kite. But I remember each contraction being like, ow, and going back to sleep. So I just want to put that out there. I did feel them. But anyway, when I woke up, I was 5 centimeters. And I was like, okay, baby, this is happening. I'm dilating. There's nothing wrong with me. We're going. Fast forward, I ended up laboring. And I was working with midwives, and they knew very much what my plan was and what I wanted. And I am a very outspoken person, so there was no confusion about what I wanted my birth to be. But it got to a point around the 68th hour where the baby was going into distress, and I was going into distress, and it was very intense, and I started to feel like my body was like shutting down almost, like different than just the pain of contractions. I think I was so fatigued from the 3 days of labor and contractions that I couldn't, like, my body felt different than it's ever felt. And they were very patient with me in trying to allow me to have a trial of labor. I will say that. But ultimately, his heart rate started going down, and they were very concerned. And so the SWAT team of doctors and nurses in coats with the clipboard came in, and I will never forget that moment. And they, it wasn't an emergency C-section, but it was a dozen people that was like, it's happening now, we're doing this, or it's going to become an emergency C-section. So off we went. And I think because I had labored so long, and because he was in distress for so long, and I didn't know this in the moment because they didn't obviously tell me this in the moment, but he came out like purple and not really breathing. And I think everybody was pretty convinced that he might not make it because he had been in distress so long. They brought him to the NICU. He eventually pinked up and recovered miraculously and was brought to me finally. And it was extremely long and tiring and traumatic, but he survived it and I survived it. And I was at that point just grateful that he was alive. In time, in my months following, there was some postpartum depression and grieving the loss of the birth I wanted. Once I processed, like, he's alive, and I'm grateful for that, I was like, but why? I tried for 3, like, what could I have done? I went to classes and I read about it, and I feel empowered. Like, what happened here? And it would take me years to really come to the realization of what happened. But that was my C-section.
Man, yeah. So then you had some life experience and then had another baby on the way.
Yes.
So how did you decide you were going to go for a VBAC? Had you decided that right after? Were you like, I didn't have the plan I was going to have, so I'm going to go straight for VBAC if I ever have another baby? Or were you not sure? What was that like?
So I I think I didn't really think much of, I mean, I always knew, because I had become educated on VBACs already, so I knew that I could if I wanted to, and that I absolutely would want to try, but I hadn't really planned too much. And but yeah, I think I did plan on having one when I ultimately had a second child. And then as it would happen, because life is fun, I ended up staying with my husband until until I was about 3 months pregnant with my daughter. I tried to make it work, and then some pretty devastating news came, and I decided, well, I'm going to do this one on my own. So I was truly doing it on my own. I mean, like, completely, and going through a divorce. So the pregnancy was very hard for me emotionally, because I was emotionally feeling like I was alone, kind of like I'm alone in this marriage, but I still was with him. And now I was like, no, I'm literally a single mom who's going to go through a pregnancy and a birth like 100% by myself, which is a very different feel. It was a different feeling for me. And I think that when I was going through the pregnancy, because of all of the traumatic stuff that was happening in my life with the divorce and a lot of really upsetting things, I was very afraid of miscarriage throughout my pregnancy, because it was so intense. There was 2 moves when I was very pregnant. There was verbal and emotional abuse. There was fear of not knowing where I was going to live, and financial stress. And so for the majority of my pregnancy, I wasn't totally sure I was going to be able to sustain the pregnancy. So when it came time, my tribe, my Babies in Common tribe, and my friends and my family rallied around me and loved me and supported me and empowered me and tried to boost me back up. And it worked, and I felt empowered and strong. And then when it came to the actual birth, I went into labor on my own, and it was pretty, standard. There weren't any complications. I went into labor. I went to the hospital. Similarly, I think someone had said this. I went in. I wasn't that dilated, but I went to Newton Wellesley, so I didn't want to drive an hour back and forth, because I was very afraid, even though I know it's not common and everyone laughs at me. I was like, I'm going to have a baby in a car. And they were like, you were in labor for 69 hours. You're not going to have a car baby. And I was like, but what if I do? So I must have watched it in a TV show, but I was like, it's going to come out in my car. I was anyway, the point is, my mom was with me, and we got a hotel near the hospital, so I could have my own space and not feel rushed and not have them start interventions and wait till my contractions were like really coming.
And you had a doula as well.
I did have a doula. We had not called her at this point yet, but I did have a doula, and she would come a little bit later. So I went to the hotel. Contractions started, and they called the people to come check on me, because I was having very loud yelling contractions in the hotel room. And I think they probably, I mean, I don't know how many of you have actually had contractions naturally, but I think they probably thought I was either having really great sex or like being murdered, one or the other.
That sounds accurate to me.
Like deep guttural moans and screaming and yelling and saying shit, and like they were like, I'm just gonna make sure she's not dying. So that was nice. But so someone came up and like, is everything okay? And she was like, my daughter's just in labor, it's fine. Anyway, bottom line is, I scared an entire bar mitzvah of people who were downstairs as I walked by, because I was clutching a pillow and I was like, ah, like just screaming, and they were like, all these 13-year-olds just like, what? So that was that. Went to the hospital, they admitted me, started the process. So it was about 24 hours of labor with my daughter, which for me, I was like, woo, this was a breeze. Like, that was it was one day, only one day.
Wait, Chelsea, had you gone to the same hospital with Isaiah?
Yes.
Okay.
Same hospital, and
same
midwives.
Okay.
Yep. And yeah, but I didn't have a doula with Isaiah. So anyway, labor was going. When we got to the hospital, called my doula to have her come, spent a lot of time doing the, you know, having contractions, and then after like an entire, you know, I don't know, must have been like 10 or 12 hours at that point, I started to be like, oh, I'm so late. And like, oh, by the way, my doula had just been at another birth for like 18 hours. She came directly to mine. And I was like, well, I don't want to like put you out with my birth. So like, go home and like go take a shower, get rest. Like, no, do you need something? Do you need me to make you food? Like so I told her to go home. I felt like an asshole because she lived like probably 45 minutes from the hospital. I sent her home. She got in her car. She drove 45 minutes, pulled in her driveway. Oopsie. My water broke. And I was like, oh my God, it's going to come out. The baby's going to come out because my water broke. Because with my son, my water never broke. And apparently I forgot all the information I ever knew about birth. And I was like, it's happening. So I called her and I was like, I'm so sorry. Can you please come back all the way? Because I am now going to have a baby, which I didn't. She came all the way back and I was just like, hi, still in labor. Anyway, so I was in labor for a good deal longer and then it got going. And this is the part where it's really fun because so as I mentioned, I obviously wasn't hallucinating or delusional. I knew I was pregnant. I had a big belly. Like part of me was very rational and clear that I was pregnant. But as I mentioned, there was this dystonic reaction because of what my life was and my trauma experience where I really was too afraid on some subconscious level to accept that this baby was real and that it was going to happen because I almost lost my son when I gave birth to him and now I'm doing it alone. Like I just was like, yeah, we'll wait and see because chances are the way things have been going, like this is not going to go well. And so out of my own protective measures, I was preparing for the worst. And I wouldn't, you know, I'm a therapist. I would never advise someone to do that, but that was my true reaction. And then we got to the point where I was ready to push and it was different. It felt different. And I think having been through labor the first time, I took a lot that I learned in my labor process as far as the breathing and just even how to handle myself with the contractions. I felt more in command of my body after having 50 weeks full. I mean, I was like a long labor. I really learned how to deal with them. Like with my son, it was a lot of like bracing myself, like, okay, it's coming, like being almost fearful. And then after learning how to really go into it and not brace and resist, but to really like let it flow through me, I was able to like harness the energy of the contractions and not let it be against me, but let it be like through me, which I didn't understand before being in labor. But in my second birth, I was like, okay, it doesn't make the pain go away, but it makes me able to handle it better. So it felt a little smoother. And then we got to the time when I was ready to push. I pushed for, I honestly can't remember. I think it was less than an hour, probably about an hour. And I still, and I'm saying this because I think it's important, I still thought as I was pushing this baby out of me, or trying to push this baby out of me, like, this is not going to happen. You're not going to be able to do this, which I hate saying because with every client I have, with every friend I have, I'm like, no, like, I don't believe that. I'm like, you manifested, believe it. You have to believe it. You have to manifest, say what you want, envision it. Like, that is who I am. And that is what I believe. And it's not like just sounds good, but like, I truly believe that. But I was so scared and so convinced that I wasn't capable of doing this, that I was like, this isn't real life. Like, this isn't going to happen for me. And I almost started to like be okay. I was like, and it's okay. Like, you know what? You did your best. It doesn't mean you're a failure. Like, I was already talking myself down from failing at it while I'm in labor. And it wasn't until, I mean, I was really pushing. They were telling me they could see her head, which I hadn't had that experience. I didn't get that far with Isaiah. And I was like, oh, okay. And it wasn't until her shoulders came out, not her whole head. Her whole head came out of my vagina. And I was like, I might have a C-section. I don't know. Because I was so convinced that like I might not be able to do, they couldn't do that. That's not how that works. I know that rationally, but I was like, this isn't real. And then when the shoulders came, there's no denying it. And I was like, holy shit, I just pushed a baby out of my vagina. I did this. And the nurse was this awesome black girl. And she was like, you did that, girl. And I was like, yeah, I did. Like, it was unreal. I could not believe it. And then came this unbelievable wave of emotion, because it was that moment that I could accept, like, oh no, you're pregnant. No, you have a baby. Like, this is real. You really have a baby. She's not going to die. You're not going to miscarry. You're not going to lose her. You're going to have her, and she's yours, and you can do this, and you can do it by yourself on your own. You can survive this because you have it. You can do this. It was like this culmination of like the realization and acceptance that I'm pregnant and I'm having a baby and it's mine and I'm going to be okay. And there's life after death and life after divorce and all that stuff in this one moment with this one gush of blood that had a baby in it. And it was incredible and insane. And I cried hysterically and looked at her and was just like, you're alive, you're a baby, you're real. And I pushed you out of my vag. So
and that's I literally have chills. Like, I literally have chills and I'm getting verklempt. And I have, like, all of your stories just talk to the power of humans and God, I can't say it enough. If you get a baby from inside of your body to outside of your body, however that happens, surgical birth, or vaginal birth, or whatnot, is fucking superhero status. Like, that is amazing. And so many women, so many birthing people feel like they failed because they had a C-section, and we really need to stop that narrative, right? Because everybody deserves to feel triumphant. However, they give birth. There's so many emotions to that, and I feel like it's our culture. And I mean, I know I felt like my body had failed when I had 3 miscarriages. I was so angry at my body. I thought that my body was broken. Mm-hmm. And when I even got pregnant and saw that heartbeat on the ultrasound, which I had never even gotten to that point, I felt healed in ways that I didn't think I ever could. Right. So, you know, I want to remind everybody that your body is not broken, right? Like, if, you know, you got two single cells grew a human being in your body, like, that's magic. How is that not magic? You know, your body is not broken. Every baby is different. Every birth is different. Every situation surrounding birth is different, physically, emotionally, whatnot. I'm so proud of all of you guys. I feel like, oh my God, I've been on every word. And there's another thing I wanted to mention is, you know, a couple themes that you've all brought up. One is, it is okay, and I want you to hear me, if you have had a birth experience that was different than you expected, I want you to hear me say it is okay to grieve that loss of that birth experience and still be grateful and happy that you have a baby in your life, okay? Hear me say that, from shouting it from the mountaintops. Too many times, birthing people are told, well, you should just be grateful, Chelsea, because your baby didn't die. You should just be grateful, Heather, because you could have hemorrhaged to death. You should have been grateful, Linda, because your baby was in distress. Thank God that you had a C-section. Just be grateful. And you can be both. You can be both grateful that you had a surgery that saved you or your baby's life, and also be sad that you didn't get the birth experience that you were hoping for. You can be both. It doesn't make you a bad person to feel that way. It is normal to feel that way. And you have to give yourself time to grieve the loss of that experience. That is normal, healthy. And you can do that with a trusted friend or your partner. You can do that with a therapist. I'm so grateful that Linda mentioned therapy, and Chelsea, you mentioned therapy. Heather, you mentioned therapy. Let's normalize that, right? Let's normalize that it is okay to talk to a professional about how we are feeling. And the other thing I'd like to mention is I recently took a training through the Birth and Trauma Support Center. Google it, it's excellent, about birth trauma. I took it as a birth professional, but they also have workshops and webinars for people who have experienced birth trauma. And one of the take-home messages was that time in the few weeks after birth, whether your experience was traumatic because of just the situation, right? Like you needed medical intervention to save you or your baby's life, and everything worked out exactly as it should have, but it was still traumatic because you had an emergency, or if it was traumatic because of the way you were made to feel or the way you were treated in labor. Talking to a professional in those first few weeks after the experience can help your brain not make that trauma response into something that can get triggered in really serious ways in the future. It can help you reorganize that memory so that you can have a healthy relationship with that memory instead of a traumatic relationship with that memory. So too many people are thinking, oh, I'm just going to try to forget about it, right? I'm going to try to forget it ever happened, and I'm going to stuff it away in a box and put it in my closet and not think about it because I'm told I have to be grateful for this healthy baby. But the sooner you get to talk to a professional and process that experience, the better. So I didn't know that before I took this training. I didn't realize that, your brain is imprinting these trauma experiences. Chelsea, as a licensed mental health counselor, social worker, you can probably talk a little bit more about that, right?
Yeah, actually, I was, two things to piggyback on what you said that I think are really important. And so the first thing that you brought to my mind is, so many times I hear clients who are, so I specialize in trauma, so I'm often dealing with people who have had significant trauma in their past, and in processing and trying to kind of come to terms with it, I hear the same things of, I know it could be worse. I mean, people are, whatever they're talking about. I mean, it could have been this, it could have been that. Well, at least this didn't happen, because we're constantly downplaying and, saying things to minimize our experience, because we're not allowed to have the feelings. We're not allowed to have the feelings.
My therapist calls that the grief Olympics. She always tells me, it's not the grief Olympics. You don't have to have the most trauma in the world.
So it's a normal reaction. I mean, I do this for a living. I'm a trauma specialist, but in my own experiences, I do the exact same thing. But when talking to my clients, or when talking to anyone who I'm helping process trauma, the example that I give is, it's like, if you had two children, let's just imagine, and this is, a morbid example, but it's important to drive it home. If you have two children and one of them got hit by a car, can you imagine how crazy it would sound if someone's like, well, you're lucky, they both could have gotten hit by a car. Some people lose both their kids. Like, what? Like, you wouldn't not grieve the loss of your kid. That's ridiculous. And so, while that's an awful example, and I'm sorry, my point is, each trauma, no matter how big or small, is valid and deserves to be grieved and processed, because in and of itself, it is its own trauma. And so I think the other thing that you mentioned is, people have different definitions of trauma. And so the reality is that a trauma is not defined by what happened. A trauma is defined by our experience of what happened. It's defined by the meaning that we make, which is why you can have two children who are, have things happen to them that are traumatic when they're kids, and one of them doesn't really have much impact by it. It may have been upsetting, but they go on to live a life where that memory doesn't haunt them. It's just not part of what they think about. And then you have another child who maybe had the same type of thing happen, who has flashbacks and nightmares and can't have there are significant trauma response. And that is not because one is weak or strong. It's because of how they have processed and internalized the experience. So I think, Melissa, what you're talking about, in trying to speak with a professional or just a trusted person, it doesn't even matter, just someone to actually process with is really important, because, the way you make meaning of it, and the way you can reframe it, and the way you can acknowledge and validate and grieve grieve the loss and the experience will help you to reroute the brain grooves and have a different experience so that it's not traumatic. And it doesn't mean it's not sad, and it doesn't mean it's not devastating, but it means that you are in control of the meaning you make surrounding it, so that it doesn't have to be what it is if you don't process. And I think that's really important, because a lot of trauma involves having power and control taken away.
I love
Thank
how
you
you
for
just,
saying.
yeah.
Yes, absolutely.
I love also how you use the expression brain grooves. Haven't heard that before. I love that. And I also wanted to go back too that, you know, we're talking so much about VBAC and how it can be empowering, but if someone does really need to have another C-section, there are ways to plan a C-section and find the right providers to have a beautiful, gentle C-section that can be very healing and incorporate some of the aspects of a natural vaginal birth or an epidural vaginal birth, like some of the key pieces to make that a beautiful experience too. So I just want to highlight that. We should do a whole other video cast about that too, but it's just
We're doing it on Monday.
Oh, is that right? Oh, good job us. That's right.
On Monday, we're going to be talking to a fabulous midwife who had to have a cesarean that she didn't plan on, and how she made that a positive and empowering family-centered birth experience. So, hey, great idea, Jeanette. Let's do it Monday.
We already had that idea, but we forgot it was scheduled. I forgot it was scheduled for Monday. Excellent.
There was a question in the chat from Leslie that I wanted to talk about. She asks, when do you have to consider to stop trying for a vaginal birth? If you're in a labor situation, whether it's a VBAC or not, when do you have to make the decision to go for a C-section? And the simplest answer to that question is, if it becomes apparent that continuing to labor or birth vaginally is unsafe for mom or baby, then we should have a cesarean. But otherwise, arbitrary time limits should not be placed on labor or induction, because if mom is stable, safe, healthy, and well, and baby is tolerating labor and pushing, then it's okay to continue on in the vast majority of cases for a vaginal birth. So I get this question a lot as a childbirth educator, like, well, when do you make the decision about a C-section? First of all, two things with that. Number one, I don't make that decision. The doctor doesn't make that decision. The midwife doesn't make that decision. You make that decision. Even if everybody in the world thinks that you should have a C-section, it's still your body and your choice. Now, I, as a nurse, might disagree with you declining a cesarean. Doesn't matter though. It's not my body. It's not my birth, and it's not, my risk to take. So keep that power, because that is your power. You have the power to decide how you give birth. Don't give that away to anybody else. But that being said, you hired a doctor or a midwife or whatnot to get their advice and expertise. And so if they're giving you good reasons for, that it is unsafe for mom or baby to continue on with a vaginal delivery, then C-sections, we call them necessarians, right? There are plenty of necessarians. Not every cesarean is unnecessary or, coerced or whatnot. We had 3 very necessarians for these first birth experiences for these 3 incredible women that they just described for us. Thank God for that. If, as Linda said, if you only hear one side of the story, if you are not given both sides, that's not truly a choice. So does anybody else have any last questions or comments they want to make?
I have a comment that I wanted to ask Sherry about as well, that as a birth doula, I remember the days when I was attending births and I would come home after a birth, and oftentimes it was a C-section, where I'd come home angry and frustrated with the way my client was treated, and that I thought their C-section was probably unnecessary and we'll never know now, blah, blah, blah. And then eventually, as I got more experienced and started to be more assertive with my clients about which providers they choose, which hospitals they choose, it really and I got more talented at what I did. Maybe that's part of it. Well, I don't remember details, but that we got to a point where if there was a C-section, it was necessary, or we had done so many things that everybody was at peace with that C-section, and it was so much easier to attend a C-section as a doula, but also to work with those families to get a better experience with that C-section and feel more at peace with it. You know, do you find that, Sherry, as well?
I do. You know, and thank you for including me on that question. I think that you're right. It is a pathway for birth professionals as well, is to get more familiar with what are the reasons that contribute to that. What are the tolerances and the sort of levels of risk mitigation that happen with different types of providers, different types of hospitals, policies, procedures, you know, and the talking ahead of time, especially with first timers, in their decisions around including interventions that start the labor, because that has so much to do with how it might end, meaning, you know, with induction, with, you know, the infusion of different things, because that was common, the questions or in the stories that a few of you guys told. And thank you for your bravery of sharing your stories, because we've learned a lot from you. And, you know, just hearing it, you're saying, gosh, as a doula in that situation, how would I have reacted with that? What would I maybe have said to Chelsea or to Linda or to Heather, you know, during those scenarios? And so in helping to guide that and provide a little education on, you know, where is an induction really necessary? And in some cases it really is. And sometimes, you know, it's just, you know, we're a few days post date, you know, so maybe we should think about, you know, whether this is the pathway into it, that if it raises the possibility that would be the mode of birth, you know. And so so I have found that over time I have gotten more proactive before the labor even began, you know, that and the positioning, you know, so passionate, more now than ever. And I feel like it has made an impact, because my own, looking at statistics, you know, of my own births that I've attended with families I get to support, is seeing less of those happen. Less times when I went home and needed to decompress and say, why did it have to go that way? You know, and making my own boundaries in where I, you know, and where I would go, where I see higher rates of cesarean being sort of brought to the table, so to speak. You know, for people that I've supported. And so I find that I, you know, in increasing my partnerships with providers, with nurses, with doctors, with midwives, at the two hospitals that I tend to support at, I have a better, deeper understanding of what they were looking at. Why did their tolerance sort of drop? You know, and talking with my VBAC moms, now I feel like, you know, to understand those parameters better and say, let's see if we can talk more about this. Is there more flexibility? Do we have to just come to the decision that, oh, you're 40 weeks. If you're not in labor by this day, there is no chance for VBAC. You know, and so a lot of it has to do with informational and educational support. So yeah, have a little less of those days where I'm like beating up, and more saying, okay, optimistically, what can we keep learning?
Yeah.
Thank you for the chance to say an answer.
And Chelsea, lastly, I want to see, can you show that picture again? Because I know your emotions were so high at the end when she was born, and this was
the very moment when they handed her to me, and my doula took this picture. This was the very second when it really sunk in that I'm having a baby for real. I did it. I pushed her out. I did this. This was it. Captured. Here, let me see. Yeah.
So you can just see that you're crying really hard. You were sobbing.
I don't know if you can see the computer a little bit as a glare, but you can still see it.
Yeah. Yeah.
And we're almost like your mouths are very close together, you're cheek to cheek, and
we're doing the same face, because she's like, oh my God, I just came out of a vagina, and I'm like, oh my God, you just came out of a vagina. So
she's like, what the hell happened to me? And you're like, what the hell just happened to me? No, I'm kidding. So I'd like to take the last couple minutes to go around and say like one piece of advice that, you know, is a take-home message for our listeners if they are thinking about having a VBAC. And one of mine would be consider, not everybody wants to, but consider getting your records from your first birth. Because sometimes that is very eye-opening. For example, I've had friends that were told, oh, your baby didn't fit, and, you know, you're having a C-section because of failure to progress and all this stuff, and it turns out that the C-section was actually for fetal distress or for a failed induction. And sometimes the story we tell ourselves is clouded because we are emotional and in the moment. There are certainly very real situations in which mom or birthing person or baby's life is at risk. Sometimes that's actually not medically the case. Sometimes everything was perfectly safe the whole time, but it was our experience of what was happening that made it seem like an emergency. And knowing the facts might help you make a more reasoned decision about your upcoming birth. So that would be my piece of advice. Linda, what would you say your piece of advice is?
Listening to Sherry talk, my piece of advice would be to get a doula. I'm just listening to her talk, and I'm like, I wish she was there for mine. Like, I feel like I wasn't informed through any of it until like the last 30 seconds when a nurse was like, there's going to be about 15 people that walk in the room, and it's going to look like a movie scene. And I'm glad she did tell me that because it prepped me for what actually happened. But just listening to you speak about informing everybody, and not just for your benefit but their benefit, like, I don't know, that's, if I had to go through it again, that's how I would want to do it.
What about you, Heather?
I would say make sure that you do the work to process your trauma, or however, if it was not traumatic, your first birth, and make sure that your support people are all on the same page with you, that they're going to have your back when you say, I don't want to have a C-section, or I do want to have a C-section, or I definitely don't want an epidural, or these are my code words for epidural. Make sure that you're all on the same page. That's what I would say.
What about you, Chelsea?
I would say for me, the advice I would give is to not allow your life experiences, your lack, your fears, your mental health, depression, anxiety, trauma, any external thing that you have been through that has cut you down and made you feel less than or incapable of or a failure, rob you of the knowledge and the power to own this birth and do it how you want to do it, because you don't need anybody or anything. And I mean, obviously, you know, it'd be nice to have someone there catching the baby, but my point is that's not going to make you able to do it. You have it in you. And I think that so remembering and grounding and honing into your true power, regardless of anything that makes you feel like you can't.
Beautiful.
Awesome. Best for last, Jeanette. Hit us with some advice.
There's so much out there. I think also, you know, having a partner support is so key, but, you know, like Sherry and I have talked about today a little bit and elsewhere, but so much about how you move your body in pregnancy and the moves that you do and how your partner and you can do different things at home. And even if your partner is your mother or your best friend, you know, how do you get your baby into the best position, and how do you get your partner, whoever's going to be at your birth with you, doula, and we hope someone else, how do we get them to know what they can do while you're pregnant and while you're in labor to help you more logistically as far as baby and pelvis and your body? How do we do that? Because so much of your labor and birth process is going to be the position of the baby in your body, and how much you know about that by taking different classes is really going to help. And it's going to help your partner because you're going to be in labor and not necessarily remember all of that. So having a birth partner who's done those things with you and practice them at home before you even begin to go into labor is going to be really key too.
And moo like a cow. Yes. I forgot my prime advice. I have forgotten. Through the contractions, this will forever, I will tell every pregnant woman this advice. Through your contractions, moo like a cow. Forget what you sound like or look like, or the fact that it's ironic because you might probably look like a cow. Moo, moo. I mean, like deep bull moo into that shit. I promise you it makes it better. And I want to coin that. I almost feel like I should, you know.
I think that should be on one of those artsy, craftsy, reclaimed wood boards. Quote, moo into that shit, unquote, / Chelsea Levine. I think
that's right. That's it. That's happening. What was my other one, Jeanette? Suck on this.
Yes, I say that all the time. I say suck on this all the time.
I have a lot of catchphrases. Yeah.
Oh, that is awesome. What a wonderful conversation, you guys.
So good.
Yeah, thanks, guys. This was great. Thank you guys for sharing so much.
Thank you for having us.
Yes, thank you for having us, and thank you guys who are listening for joining.
Thanks for having this whole video cast.
Well,
So Jeanette, you want to start us off here?
Yes. All right. So if you're looking for more information about VBAC, remember ican-online.org. And we also hope you will continue, anybody listening or any of our participants, to continue to attend the videocasts or to watch them recorded or listen to them as a podcast as well on Spotify or Apple Podcasts or on our website, babiesincommon.com. And our next episode is Wednesday, May 18th at 1:30. Oh, wait, is it Monday actually?
Oh, sorry, Monday. You're right. It's Monday.
Monday the 18th, yep, at 1:30, and we'll be discussing the other side of this coin. Our guest is a local midwife, and she'll be talking about how to make a cesarean birth a positive experience, even if it's not what you wanted or expected. So we hope you'll join us for that.
And as I always say, if you learned even one tiny crumb of helpful information today, don't be stingy. Please text a friend who is either expecting or parenting and tell them about us. And if you want to laugh your maternity stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live and interactive Zoom class with us while quarantining. Virtual lactation consults and support groups are also available. And if you like Babies in Common on Facebook, we're always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent. We are a community for you. After all, we all have babies in common. Yes. Thank you, everybody.
Bye, guys.